Welcome, everybody, to today's episode of The Lindsey Elmore Show. This episode is all about the thyroid. So when people are diagnosed with problems with their thyroid, it can be one of those like rabbits that you're constantly chasing, because the thyroid is not something that's just in balance or out of balance. It takes a long time for things to fluctuate and to really understand the patterns of the fluctuation, because the thyroid is supposed to behave differently at different points during the day. Today, I interviewed Donna Mazzola. She's a pharmacist who was diagnosed with Hashimoto's thyroiditis, which is the most common cause of low thyroid in the United States. Here's the thing. It is also an autoimmune disorder that can be healed through nutrition and diet, similarly to other autoimmune disorders. We talk today about all of the different nutrients that play into the development as well as the pervasiveness of Hashimoto's. We go far beyond just iodine and really dig deep into the mechanisms of how do minerals like magnesium and selenium and zinc play into Hashimoto's. We talk about foods. We talk about an amazing study all about Brazil nuts outperforming selenium supplementation. It is a great conversation, and it is so critical that we, as me as your host and you as the listeners, inspire people to understand that a diagnosis of a thyroid disorder is not the end of the world. And there is something broken in our modern medical system in the way that we treat thyroid disorders. What do we do when someone comes in and they say, oh, you have low thyroid? Well, people just supplement with a thyroid supplement. Levothyroxine, Synthroid, even though they are medications, they are still simply supplementing with thyroid hormone. The problem is that thyroid balance goes well beyond what you can just supplement, because if you're supplementing but you can't convert into active T3, well, that's a major problem. Plus, if your thyroid is out of balance, 9.999 times out of 10, your adrenal glands are also out of balance. So there is an interplay with all of our endocrine system that makes it so critically important that we do more than simply throwing a supplement on top of a hypothyroid condition. So today, let's talk about vitamin D. Let's talk about foods. Let's talk about what truly goes awry that can lead to the development of Hashimoto's thyroiditis and what we can do to fix it. Let's get to the show. Welcome to The Lindsey Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. From a young age, Donna Mazzola had always had a passion for natural healing and preventative care. After obtaining a doctorate in pharmacy, the passion that she felt from that young age became an obsession, as what she had learned in pharmacy school conflicted with many of her core beliefs. She realized that medicine has a place in healing, but it's actually the balance between nutrition and medicine that can create real impacts on disease. After Donna obtained her doctorate in pharmacy from Ferris State University, she continued her training by completing a residency program at Detroit Medical Center. She spent 10 years in clinical practice doing medication therapy management. When she was speaking with her patients with chronic illness, she was constantly blown away by how little they knew about managing their disease through lifestyle interventions alone. This led her to pursue a master's in nutrition, which she started and then stopped, and then switched gears to get an MBA because she realized that she was going to have to become a pharmacist entrepreneur. In 2015, however, her full journey came into focus when she was diagnosed with Hashimoto's thyroiditis. This condition took her right back to the passion to understand not just what to do to treat the condition, but why she had an autoimmune condition in the first place. She realized she didn't know who to trust. There were too many opinions online, and too many of them were confusing. So she decided she would become her own source. She embarked on a journey to further her education and ended up finally getting that master's in human nutrition and functional medicine from the University of Western States. Through her journey throughout school, she started Autoimmune Girl LLC to be able to share trusted information with people who were also suffering from thyroiditis. This has now become her purpose, to share reputable scientific information in a simple format. Dr. Autoimmune Girl is a blog with a mission to identify the root causes of disease through health and wellness, and to create a balance between nutrition and medicine. It is here to empower readers and followers to understand that they can take back control of their health and disease. Dr. Donna Mazzola, welcome to the Lindsey Elmore Show.
Thank you. I'm so excited and privileged to be here.
I know our listeners are going to be thrilled to hear from you because you went through your own journey with Hashimoto's, which is the most common thyroid autoimmune disorder and the most common cause of thyroid dysfunction in general. It often goes undiagnosed, underdiagnosed, undertreated, overtreated. It leads to a lot of patient care issues and a lot of interactions with the healthcare system. And honestly, most of our listeners just really want to know how to care for themselves naturally. So talk us through how you first noticed that you might have something going on with your thyroid, and how did you ultimately get to this diagnosis of Hashimoto's?
Yeah, absolutely. I mean, it's crazy initially when I found out I had Hashimoto's, I mean, I was like struck by surprise, right? Because for me personally, for anybody who knows me, I mean, I've always been very heavily involved in preventative health. Even as a pharmacist, that was always the direction I went in the ambulatory care setting. And, exercise regularly. And so it kind of came as a shock. And really what it was is I was honestly training for a marathon and was eating very healthy. So I was following this very strict, healthy diet, high nutrient dense foods. And I was running a lot, right? So, I mean, throughout the week, excessive miles, and then of course on the weekends. And I just kept noticing myself gaining weight. And it just didn't make sense, right? So we talk about those obvious symptoms, and obviously, that is one of them, but it really stood out because in my mind, not that I was trying to lose weight, but it was like, gosh, why am I gaining weight? And so I went to a provider, and, it wasn't a functional medicine or integrative medicine provider by any means, but it was one that was willing to listen. So I think that's key and important. And she said, you know what, let's check your thyroid levels. And at that time she checked TSH only. And that's typically what we'll see happen. But then she also checked cholesterol. And so I like to highlight that for people because, they go hand in hand. You think about thyroid and kind of the workhorse of metabolism in your body. You also, correlate that to cholesterol as well, right? So she checked the TSH, checked cholesterol, saw that my cholesterol was elevated, but that didn't make sense because, like I said, I'm eating relatively healthy. Why would that be elevated? And so that led, okay, you know what? Let's then dig a little deeper, because my TSH, while normal, was high normal, right? So we think optimally we want our TSH between 1 and 2 to really alleviate those symptoms that we see. And the range in conventional medicine is so broad, right? It's about, give or take, depending on the lab, about 0.5 to 5.5. And so my levels were around 4. So normal, but not normal. So I was fortunate enough that she took it a step further and said, you know what? I think you have something going on with your thyroid. This is elevated while it looks normal, and your cholesterol is high. And so she went on and checked T4, T3 levels, and antibodies. And that's the key here, because T4 looked good, T3 looked good, and I guess you could say TSH looked good, right? It was in normal range. So any doctor looking at it would be like, nope, you don't have a thyroid issue. My antibodies were through the roof. And it was shocking, And so it was like, what is going on? And why did this happen? And so for me, being in healthcare, and I just had to take a step back, and that was really the question, like, why me? And I started digging, I started reading, I started researching, and to be honest, that's what really took me on my path of functional medicine and pursuing a degree. It was really to try to identify how to fix and help myself, and understand why I developed an autoimmune disease, and understand really why it's an epidemic, autoimmune disorders right now. And so taking me down that path allowed me not only to educate myself, but then to also disseminate that information and empower and educate others. And at the end of the day, I may not be the provider, but I'm empowering you to ask the right questions, to have that knowledge, to be able to push provider, the one that's in front of you that's ordering your labs, to dig a little deeper and identify what is going on and how can we really tackle this, with or without medication. So I always say it's a balance. You very well, many Hashimoto's patients do need thyroid hormone replacement, but at the end of the day, my focus as a pharmacist is always the lowest possible effective dose, right? And that's what we push for. And so if we can maintain our diet and also, consider supplements that may help that thyroid function and metabolism, then we can maintain that dose and maybe even decrease it. For some, maybe they can get off. For others, this is a long-term diagnosis, unfortunately, right? You can put it in remission potentially by reducing antibodies, but it's going to be there. And so knowing that, we want to be able to delay that progression as much as possible.